Okay, folks, I just finished a week of ICU. And let me tell you the typical scenario that I witnessed or the typical patients. So we saw quite a few patients that were baby boomers or older, metabolic syndrome, or tons of frailty. When I look at those three buckets, that was a vast majority of the patients we saw. Why am I telling you this? Because I think there needs to be urgency for our older population to get in the best shape of their lives. And I know that sounds extreme. And I know this sounds like hyperbole, but when we look at what our current medical state is, where we don't have enough resources, we're seeing increasing in metabolic syndrome. We see people with less steps. We see people more attached to their phones, people sleeping worse. Why am I telling you all this? Is because I feel like there's something we could do about this. I feel like if we have that lens of urgency, individually, collectively, as a society, we can overcome so much of this. Make prevention front and center. So this is a very short cast, but I'm going to just give somewhat of a prescription for you. If you're my age, your parents, or if you're my age right now, that prescription for life moving forward so that we avoid having to be that resource heavy patient. Because that's the other thing that we saw. A lot of the patients, they're not first-time comers to hospital or ICU. They've come in repeatedly because of complications. So if we could get ahead of the curve, there would be less of a burden on our system, less of a burden on acute care, and allow us to exhale, allow us to meet the demands of a ever increasing demanding healthcare needs. So this is what I would say. You're not in the best shape of your life. You're struggling to maintain to lose weight or to get back to a healthy existence. Let's focus on nutrition. I just want you simply to focus on your protein intake. That's it. Whatever's on your plate, increase it by 50% or more of protein. I don't care if you are vegan. I don't care if you're carnivore. When you normally put that chicken breast on your plate, make it a chicken breast and a half, or make it two. Stack it up with the vegetables. Stack it up with the greens. Stack it up have your fruits, your berries, whatever you want. But focus on that protein. And you've heard me say this once. I'm going to say it again. You're going to maintain your lean muscle. You are going to feel fuller, so you're going to make better food decisions. You are going to have better grip of your insulin. You're going to have better glucose control. You are going to burn more calories just by digesting protein. You're going to be a beast. You're going to start winning. That's the only thing I want you to focus on when it comes to your nutrition. Two things when it comes to your exercise. I want you to either increase your step count by 25%, or I want you to focus on weight training. If you can afford it, hire a trainer. If you can't, start looking up body weight exercises you could do at home, and start now. Start creating that foundation. When you're in ICU, you lose about 1% of muscle mass a day. And what you die from is frailty and weakness. The ones that do the best are the ones that have that foundation, that are strong, that can overcome whatever's coming their way. Muscle is currency. So whatever you could do to put on that lean muscle, let's go. From a stress perspective, I'm just going to keep it simple. Improve your sleep quality. Most people, it's going to be as simple as avoiding their phones close to bedtime or using blue blocking glasses. Choose one of those two things. And the last thing that I'll say in terms of trying to improve your health right now is socially connect. Reach out to your loved one that you haven't talked to in a while. Shoot them a text. Give them a phone call. I'm just out of somebody I'm going to do this to right after recording this bad boy. But make it happen. We know that social connection is a magnifier in terms of improving your health and wellness. All the blue zones, that's the magic sauce, folks. So choose one of those things. Once again, on the nutrition side, protein. From the exercise perspective, some form of weight training or increasing your step count. Improve that sleep quality, throw on some blue blocking glasses, avoiding your cell phone close to bedtime, and connecting with others. This is based on our press method, but I don't give a damn what you read or what source you use. I just want us to have that urgency, have that agency to know that you could get healthier, and let's put less of a strain on the system, because our system is not thriving right now, and I do not see light at the end of the tunnel right now. But how exciting is it if you could take that power back? If you could say, hey, I'm going to show up as the best form of myself to avoid leaning in on that acute care system. And don't get me wrong, if you need it, we're there. Absolutely. We want to be there for you. We're there. This is why I do what I do. But I've seen this other side of that. I've seen the pain, I've seen the suffering, I've seen the PTSD, I've seen the sadness, I've seen the death. This last week, I've probably seen, how many patients of ours, probably half a dozen of patients died in my week of ICU. And I've seen that pain in the families. I don't want to see that if we don't have to. Everyone dies at some point, but I wanted you to die after, not because of lack of information or lack of access to care. I want you to die on your terms, showing up as your best form of yourself in the best shape you've been in, mentally and physically. So this might seem a little bit out of left field, a bit extreme, but I'm telling you guys, we have it in us. We have it in us to be a healthier society, and it starts today. Reach out, DM me, whatever you want in terms of what your first steps need to be, but we're here for you guys because this is something we feel very strongly about. Thanks for listening.